So options for breast implant exchange. So first of all, why may you need your breast implants exchanged? There is no set time period after surgery that they need to be exchanged. So the 10-year mark is often something that people come in saying, I need my implants exchanged. It's been 10 years. That is actually more of an implant warranty. So a lot of implants come with a 10-year warranty where if you have rupture or capsular contracture, then you have the implant and some of the surgery fee cost covered under that warranty. But as long as the implants look good, feel good to you, they suit your body, you can keep them in for much longer. Common reasons why people will want them exchanged are an implant rupture. So that is a little hole in the implant. If it's a saline implant, it produces complete deflation, so you know right away. If it's a silicone implant, either you'll know because it causes some capsular contractures, you can actually feel some tightening of the breast, or it's picked up during your routine implant ultrasound. Or with time, pregnancies, age, weight changes, the implants may no longer sit the way you want them. They may sit a bit low. The implants themselves may sit a little bit high with the breast tissue that has now sagged over top of them. They may not be the right size for you anymore. So that would be another very common cause for exchange. Or pure capsular contracture, where you have tightening of the scar tissue around the implant that causes some distortion or pain, but is not associated with an implant rupture. So in these cases, assuming you still want to continue on with implants, you have a couple different options, and they're really going to depend on what your initial situation is. So the very simplest is just implant exchange, where we remove the old implants, rinse everything out, and then put in a brand new set. They can typically be a bit bigger or the same size without need for anything extra. If you want an implant exchange, but you want to go smaller, typically now that is going to be a bit more involved. That surgery is going to need to shrink the pocket where the implant is sitting and often add a layer of supportive structure like a dissolvable internal bra mesh to support the new size and shape of the implant. Second option is to do an implant exchange with a lift. So often if people are coming in, their implants are fine, but they've gone through pregnancy, whatever it may be. Often they have that waterfall deformity where from a side view, the implant is sitting up here and the breast is sitting a bit low. In that case, I'll go in, put a new implant. Sizing is completely flexible. Depending on your base width, we'll go through the range of sizes that work for you. And then also do a lift to now move up the breast tissue to meet the position of the implant. These adjuncts can all be combined with fat transfer, which is a very common adjunct to narrow cleavage lines, minimize rippling in my thin patients, and that is through liposuction and harvesting of fat from somewhere else. Let me know if you have any questions.